The last in the topics from the cardiac chapter, although I don't know what order you're going to be watching these, so this may be the first. But anyways, the last one in our list of objectives is aneurysms. We really have two things we're going to deal with. One is an aneurysm and another one is a dissection. So what we typically think of is a triple A, abdominal aortic aneurysm. And an aneurysm is where there's a bleb or a pouching out of the artery due to weakness in the wall, sometimes due to hypertension, sometimes atherosclerosis, and it oftentimes occurs where there's a branching to another artery. And these blebs grow and may not even be causing any signs or symptoms for the patient until they're almost nearly ready to rupture. If it is a AAA in the abdomen and you have a skinny patient, you might be able to see the pulsing of the abdominal aortic aneurysm every time the heart beats when you're assessing the abdomen. Sometimes on palpation you can even feel it. Now I've only seen it a time or two in a couple of my patients that have been very thin, usually elderly. But it's something that you might note when you do your abdominal exam. Avoid the temptation to poke at it because you sure don't want it to rupture. When these rupture, then they bleed out, and you have to excuse my drawings. I'm doing the best I can. I don't claim to be a professional artist. Then they have massive bleeding, and if this is an abdominal bleed, then you may have tenderness and rigidity to the abdomen. You may have weak or absent pulses in the legs bilaterally. If it's a lower aneurysm where it's just in the femoral artery, then you may have one side that's weak or a weak pulse compared to the other, or the legs may just look very pale because there's no blood flow going to them. If this happens higher up in the like the thoracic cavity, you could potentially have weakness to pulses to one side or a lower blood pressure on one arm versus the other, although we tend to see these more in the abdominal cavity. Now we do see aortic dissections more in the thoracic cavity, and here is where it tears apart, and these patients oftentimes will complain of a sharp pain, sometimes a very tearing pain. It goes through to their back. It's kind of a classic sign for test questions and registry questions, is that you'll have tearing pain or back pain that's sharp, sudden onset. The treatment for all of these patients are just going to be to keep them as calm and as still as you can. If you're having chest pain with it and you suspect this is cardiac in nature and they have a prescription for nitroglycerin, you can still use that as long as their blood pressure is good. If you are really truly suspecting a aneurysm or a dissection, you want to avoid aspirin and transport them to the hospital. There's really nothing we can do for these pre-hospitally. These has to be fixed in surgery. So all we can do is suspect them and try to notify the hospital early.